This video presentation is on competency number 6, engage with individuals, families, groups, organizations, and communities. Our group consisted of Jennifer, Shauna, Taylor, and Angel. According to the Council on Social Work Education, social workers understand that engagement is an ongoing competence of the dynamic and interactive process of social work practice with and on behalf of diverse individuals, families, groups, organizations, and communities. Social workers value the importance of human relationships. Social workers understand theories of human behavior and the social environment and critically evaluate and apply this knowledge to facilitate engagement with clients and constituencies, including individuals, families, groups, organizations, and communities. Social workers understand strategies to engage diverse clients and constituencies to advance practice effectiveness. Social workers understand how their personal experiences and effective reactions may impact their ability to effectively engage with diverse clients and constituencies. Social workers value principles of relationship building and interprofessional collaboration to facilitate engagement with clients, constituencies, and other professionals as appropriate. There are 2 practice behaviors that align with Competency 6. The first one is to apply knowledge of human behavior in the social environment, person and environment, and other multidisciplinary theatrical frameworks to engage with clients and constituencies. The second one is to use empathy, reflection, and interpersonal skills to effectively engage with diverse clients and constituencies. Engagement happens in any relationship. Positive engagement involves actively listening, demonstrating empathy, and respecting their client. It is important for a social worker to build a strong rapport with their client to be most effective. It is crucial that a social worker engages with their clients effectively, which builds trust and allows the client to open up. Once the client has opened up, the clinician can then use various theatrical frameworks to engage with the client. Jennifer's evidence. This assignment was a reading, reflection, and discussion within the class on nonverbal communication and attentiveness when working with individuals. It aligns with practice behavior 6.2, use of empathy, reflection, and interpersonal skills to effectively engage diverse clients and constituencies. The assignment helped to explore how nonverbal communication can impact the connection a social worker has with the client. The reading and discussion helped me to gain knowledge about the different types of attentiveness social workers need to develop in order to utilize these skills in practice. Nonverbal skills can be portrayed through the physical movements, tone of voice, and eye contact. While completing this assignment, I was able to reflect upon my own use of nonverbals when I work with clients in order to gain knowledge about my personal habits. This self-awareness is an important piece when trying to build a therapeutic rapport and engage individuals. It allows social workers to be able to respond in an empathetic manner and be aware of how interactions are being perceived by the individual, family, or constituents. Having this knowledge increases my ability to better have interactions with the individuals I engage in services and within the profession. In Social Work 503, we were given the opportunity to utilize the knowledge we had learned in class about nonverbal and attentiveness skills by applying these skills with a simulated client. After the session with the simulated client, we were to watch a recording of the session and reflect back on our use of these skills and interactions. This assignment aligns with practice behavior 6.2. Use of empathy, reflection, and interpersonal skills to effectively engage diverse clients and constituencies. By watching the recording, I was able to see when I used the skills to reflect the individual's feelings back to her and empathize with her situation. This practice behavior helped with the engagement process and to build a therapeutic rapport. I was able to see interpersonal skills such as presenting in a calm way, being non-judgmental and non-confrontational. I offered encouragement, promoted strength, and offered support. I built and practiced skills to help the individual stay focused and working towards motivational factors to engage the individual in the session. In Social Work 505, we had an assignment to locate a community-based group in order to observe and analyze how the intervention was implemented. We were able to take notes on our observations related to the structure, leadership, functionality, and other factors that had an impact on the group. This assignment allowed me the opportunity to observe how individuals were engaged in a group setting and how the dynamics of the group had an impact on the engagement of the group members. This assignment aligns with Practice Behavior 6.1, apply knowledge of human behavior in the social environment, person environment, and other multidisciplinary theatrical frameworks to engage with clients and constituencies. The observation that I chose to share as evidence for the practice behavior was the observation of a grief support group at First Baptist Maryville Church. This assignment helped me to learn and gain knowledge about how the treatment setting can have an impact on the individual's ability to engage and feel comfortable with sharing feelings. Since the group members were all affiliated with the church and it was a small group, they seemed to feel comfortable sharing and accepting the support. The leaders of the group demonstrated the skills to empathize with the group members, encourage participation, yet be able to demonstrate structure in their delivery process. The leaders also had their own personal experiences they were able to share in an appropriate way that helped them connect with the group members. I was able to gain knowledge about how an organization can collaborate together internally in order to engage individuals with a common concern. Shauna's evidence. For my first piece of evidence, I utilized an assignment out of Social Work 541. Our assignment was to build a private practice form from the ground up. We developed flyers, progress notes, treatment plans, intake forms, assessed and worked directly with the clients. We took SOAP notes and used theories to engage with the family. This flows directly with the Practice Behavior 6.1, apply knowledge of human behavior in the social environment, person environment, and other multidisciplinary theatrical frameworks to engage with clients and constituencies. After the first session, the clinical team discussed a couple of therapeutic approaches that should be considered when working with the family. The clinical team believed that the Bowen Family Systems Therapy approach was a good option for the family because this therapeutic approach would help reduce anxiety throughout the family and increase differentiation within the family. For the second piece of evidence, I used an assignment from Social Work 540. Which was a final personal reflection paper. This paper was a personal proclamation statements of beliefs and intents for your future therapeutic practice. This assignment aligns with Practice Behavior 6.2. Use empathy, reflection, and interpersonal skills to effectively engage clients that are diverse in constituencies. This paper forced me to reflect upon my experience as a therapist during the semester. I reflected upon how I used my interpersonal skills when working with a client who was using racial slurs when speaking with her husband. This assignment helped me to learn and gain knowledge about how the treatment setting can have an impact on the individual's ability to engage and feel comfortable with sharing feelings. The third piece of evidence is a journal entry assignment from Social Work 540. We completed these entries on a weekly basis, describing the theory the practitioner used, what specific techniques were used, what was challenging about this theory, if the theatrical approach was effective for the client, and describe how comfortable they were. The specific example was after I had completed a therapy session with a couple. This piece of evidence directly correlates with Practice Behavior 6.1. Apply knowledge of human behavior in the social environment, person environment, and other multidisciplinary theatrical frameworks to engage with clients and constituencies. I specifically used Gestalt theory, which is a theatrical framework, to engage my client. Angel's evidence. My first example I have chosen to present is from interactions I had with a group at BHA, which is my practicum. We discussed cognitive distortions, the different types, and coping skills for them. I opened the group to a discussion of how they perceive the different types of cognitive distortions, and they openly shared which ones affected them. They also discussed their feelings towards the different coping mechanisms I had provided them. They were grateful of their resources given and stated they plan to use them in the future. This evidence shows the interactive process of engagement, which is utilized in practice behavior 6.2. I understood the feelings the clients had about the coping mechanisms as well as how they felt when they experienced cognitive distortion. The second example is a case study I wrote in Advanced Field 3. It details my engagement with a client at my practicum. She was looking for housing. I utilized the person and environment perspective as she told me her situation that was in an environment that raised her already a lot of anxiety. I knew that I needed to find a home for her as quickly as possible as she lived in a cramped home with many people around. I understood that it needed to be a home quite the opposite of her current situation in order to reduce some of her anxiety. I interacted with this client weekly and built a relationship with her to find her a suitable home, which correlates with practice behavior 6.1. I was able to apply knowledge of human behavior in the social environment, person environment, and other multidisciplinary theatrical frameworks to engage with this client in the constituencies. For my third example, I presented the paper assigned in Psychopathology and Diagnostic Assignment. This paper details crucial information about schizophrenia, its history, ideology, treatment, and how it affects diverse populations. It also details what diverse populations believe about the mental illness. With the information presented in this paper, a social worker can enhance their skills in engaging properly with individuals with schizophrenia, such as using Practice Behavior 6.2, when using empathy, reflection, and interpersonal skills to effectively engage diverse clients and constituencies. Taylor's evidence. My first piece of evidence is a mental health assessment. A mental health assessment provides mental health treatment, history of abuse and trauma, family history, personal history, legal history, strengths, and resources. We complete a mental health assessment yearly on each of our clients, which provides us with insight as to how to apply knowledge of human behavior in the social environment, person environment, and other multidisciplinary theatrical frameworks to engage with clients and their constituencies. This provides us insight as to how and what our client has endured before they came into our care. This will guide us in when we are completing individual therapy and group therapy with each of our clients to ensure that we are able to provide them with the most beneficial therapy as possible. My second piece of evidence is a major paper that I wrote in Social Work 561, Child, Youth, and Family Services. This paper focuses on a residential treatment center utilizing physical restraints. When I completed research on this paper and wrote this paper, I was able to understand that what backgrounds the clients came from, what trauma they endured, and how whenever we go hands-on with our clients in a restraint, that can possibly bring back some of their abuse and trauma. Therefore, it is very important that we incorporate Practice Behavior 6.2, using empathy, reflection, and interpersonal skills to effectively engage diverse clients and constituencies. This is important when dealing with a client in crisis who we are trying to avoid a physical restraint. Therefore, it is important that we are able to speak with the client in a calming manner, reflect their feelings, and ensure that we are using adequate interpersonal skills when talking with them. My third piece of evidence is from my practicum. It is an admission agenda. An admission agenda is used to admit a new client at our facility. It is a checklist that ensures we have gathered all necessary information needed to care for the client. As our client comes through the door, it is important that we have gathered all of their past trauma, what abuse they have endured, who is going to be visiting them, what other support networks they have. And this will all be able to help us when working with this client in individual therapy, group therapy, and just interacting with them while in the milieu, which incorporates Practice Behavior 6.1, applying the knowledge of human behavior in the social environment, person environment, and other multidisciplinary theatrical frameworks to engage with clients and constituencies. It is important that when we are completing the admission agenda, that we ensure that we have all necessary paperwork in place, which provides us with insight as to the client's previous behaviors, what some of their triggers are, and how we can go about calming them down in a crisis, which would help us be able to alleviate some of the problems that they have and understand how we can work with them effectively and appropriately in session. Practice placements. Jennifer's practice placement is at St. Clair County Mental Health Board. She completed her Social Work 528 and 529 practicum at the St. Clair County Mental Health Board. Her practicum aligned with both practice behaviors on a macro level. The St. Clair County Mental Health Board is the governing body that helps to distribute funds from the tax levy within the county to organizations and agencies that provide services for individuals that have intellectual and developmental disabilities, mental health, and substance use disorders. They work in accordance to the Community Mental Health Centers Act of 1963. She learned and gained knowledge that function as a community collaborator for services and also acts as an advocate with the state through an association for all of the 708 boards in Illinois, known as the Association of Community Mental Health Authorities of Illinois. She gained knowledge about the importance of human connection, relationship building, and knowledge about the importance of human interpersonal and professional collaboration at both the state and community level. During her time at the board, she was able to work with two agencies in order to collaborate and develop a memorandum of understanding. She used interpersonal skills to engage both organizations as well as reflection and empathy in order to demonstrate understanding of her current situations and past history of working together. This display of understanding and use of interpersonal strategies helped to engage the organizations and bring them together. As illustrated in the slide, she was able to participate with ACHMAI in presenting two of our state senators, Senator Bush and Senator Cullerton, with a plaque of appreciation for their work towards the state budget, with the emphasis on helping the vulnerable populations in the state of Illinois. This act demonstrated a strategy to engage and connect on a state level. It showed the value the organization has in building relationships politically in a professional way. While practicing and participating in these meetings, she gained knowledge and growth in the value for collaborative efforts. The engagement of all the organizations together allowed them to have a stronger voice in order to advocate effectively for those in need. Shauna's internship is at American Red Cross Disaster Services. Every day, Red Cross disaster action teams are on call to respond to local emergencies. Whether a home fire or a regional flood, disaster action teams are ready to assess damage and provide emergency assistance. During the initial days following a disaster, the Red Cross meets immediate individual or community needs for food, shelter, clothing, and care. Red Cross health and mental health volunteers also travel to disaster sites to help people cope. Health workers can provide first aid treatment for injuries, monitor the well-being of people staying in Red Cross shelters, and replace prescription medications or eyeglasses. At the Red Cross, we directly engage with clients on a daily basis, trying to help them during their time of need. At my agency, we utilize Maslow's hierarchy of needs when assisting clients, learning where best to apply our resources and help during their recovery process, which applies to the practice behavior, apply knowledge of theatrical frameworks to engage with clients and constituencies. Taylor's internship is at Hoyleton Youth and Family Services. Hoyleton is a residential treatment facility that serves children ages 9 through 21 as they address developmental disabilities, severe emotional problems, or profound behavioral issues. Clients who are referred to Hoyleton majority of the time are in need of mental health treatment and services. We offer individual therapy, group therapy, in terms to help the clients be able to focus and to be able to learn how to cope with their emotions, their past abuse, and their trauma, which correlates with competencies 6.1 and 6.2, as we strive to work with not only the client, but also their family, their communities, and organizations that have referred them to us. Our mission seeks to enable all people, young and old alike, to realize the wholeness of life that God intends. This will be accomplished with the compassion of Jesus Christ and the power of the Holy Spirit, reaching out to meet the physical, emotional, intellectual, spiritual, and social needs of those with whom we journey. Angel's internship is at Behavioral Health Alternatives. Behavioral Health Alternatives is a mental health-based facility that provides individuals with comprehensive outpatient mental health services within a recovery-based care management program. The care management program offers services to adults struggling with mental health issues. An array of therapeutic interventions are provided to stabilize mental health symptoms, facilitate personal growth, enhance community participation, and educate individuals about their mental health diagnosis. Our professional staff assist individuals in resolving emotional issues and developing the skills needed to promote mental health recovery. Services provided in the care management program include mental health assessments, psychiatric services, individual therapy, group counseling, psychiatric medication education and training, representative payee services, and linkage to resources in the community. Daily, each case manager engages with a client where their situation is assessed when they begin coming to the agency. A treatment plan is made and implemented, and from there, the client meets with the case manager and they engage with one another. When doing so, the case manager uses skills such as empathy, finding resources, reflection, or anything else that the client may need to work on their treatment at that time. The treatment plan is reevaluated annually until the client reaches their ultimate end goal.